Advisory for pregnant women, lactating mothers and high-risk groups. In this lesson, you will learn about guidelines for pregnant and lactating women and learn to identify senior citizens and high-risk groups to prevent infection during the COVID-19 pandemic. By the end of this lesson, you will learn about guidelines and advisory for pregnant women during the COVID-19 pandemic, guidelines and advisory for lactating mothers on breastfeeding during the COVID-19 pandemic, identifying people who are at a higher risk of severe complications from COVID-19 infection, preventive measures to help protect older adults from COVID-19 infection. First, let us watch a video about caring for pregnant women during the COVID-19 pandemic.
If you are pregnant and are worried about COVID-19, do not panic. Let's start by discussing antenatal care. If you are in early pregnancy, you may defer your antenatal checkup. But it is important to remember that 4 antenatal checkups are essential during the course of your pregnancy. Follow all instructions of your doctor or nurse. For minor complaints in early pregnancy, you may consult your doctor by phone to avoid repeated visits to the hospital. However, if you have a high-risk pregnancy, you should have frequent antenatal checkups as advised by your doctor. For an antenatal checkup, you can go to a nearby PHC or CHC or a private hospital. When at the hospital, maintain a distance of at least 1 meter from others. If you have fever, cough, or difficulty in breathing, seek medical care immediately. Let's talk about how to plan for institutional delivery. It can be risky for mother and baby to deliver at home. Hence, always plan to deliver at a health facility. If you do not have any complications of pregnancy, you may go to a health facility nearer to your home, like a CHC, PHC, or a private hospital. However, if you have any complications during your pregnancy, you must deliver at a larger hospital that can conduct a cesarean section if necessary. If you are pregnant and have been diagnosed or suspected to have COVID infection, please remember the following. Follow all instructions of your doctor and nurse. If you have mild symptoms and are asked to stay at home, follow all precautions of home isolation, including wearing a mask and maintaining distance from others. If you don't foresee any immediate danger, delay your routine ANC visit until after the recommended period of isolation. If you develop any symptoms that concern you, or you start having your labor pains, immediately visit the hospital. Inform the hospital by phone before reaching, so that they are prepared to receive you. Whether your delivery will be normal or by cesarean section will not be affected by corona infection. It will be dependent on your pregnancy status and decision of your doctor.
Now, let us look at some guidelines on breastfeeding for lactating mothers during COVID-19.
WHO recommends that all women should be supported to breastfeed. If COVID-19 is suspected or confirmed, these hygiene measures can help protect the baby. Washing your hands before breastfeeding, coughing or sneezing into a tissue and disposing of it immediately. Cleaning and disinfecting surfaces you have touched. Wearing a mask where possible. If a mask is not available, WHO still recommends breastfeeding, as benefits outweigh the potential risk of transmitting the virus.
Now, let us learn about who all are at a higher risk of severe complications from COVID-19.
Older adults and people of any age who have serious underlying medical conditions may be at higher risk for severe complications from COVID-19. This group includes people 65 years and older, people who live in a nursing home or long-term care facility, and people of all ages with underlying medical conditions, which include those with chronic lung disease and moderate to severe asthma, people who have serious heart conditions, those with severe obesity or a body mass index of 40 or higher, people with diabetes, those with chronic kidney disease undergoing dialysis, and people with liver disease, and people who are immunocompromised, including those going through cancer treatment, smokers, transplant patients, those with poorly controlled HIV or AIDS, and those who experience prolonged use of corticosteroids or other immune-weakening medications. If you are at higher risk for severe illness from COVID-19, take actions to reduce your risk of getting sick. Have supplies on hand. Take everyday precautions like washing your hands with soap and water. Avoid travel. Stay home as much as possible. Avoid all cruise and non-essential travel. And have a plan for if you get sick. If you have symptoms like fever, cough, and shortness of breath, call your doctor.
Now, let us learn about preventive measures to help protect older adults from COVID-19 infection.
Older adults and people who have severe chronic medical conditions like heart, lung, or kidney disease or diabetes may be at higher risk for severe illness from COVID-19. If you are one of the people at increased risk for serious COVID-19 illness, it's especially important for you to take action to reduce the risk of getting COVID-19 now. The first thing you can do is take care of your own health. Wash your hands often with soap and water for at least 20 seconds. Use an alcohol-based hand sanitizer with at least 60% alcohol if soap and water are not available. Cover your coughs or sneezes with a tissue, or cough or sneeze into your elbow, not your hands. Avoid contact with people who are sick. Clean and disinfect surfaces in your home, such as counters, tabletops, and doorknobs to remove germs. Use household cleaning sprays or wipes according to the label instructions. The next thing you can do is make a plan for what to do if you do get sick. Know who will take care of you if your caregiver gets sick. Talk to your healthcare provider about getting extra necessary medications to have on hand. Get enough supplies too, including enough household items and groceries so you can stay home for a few weeks if you have to. The third thing you can do is pay attention to what's happening locally. If COVID-19 is spreading in your community, stay home as much as possible and avoid crowds. If you get sick with fever, cough, or shortness of breath, call your healthcare provider. If you develop warning signs, such as difficulty breathing, persistent pain or pressure in your chest, confusion, or blueness of the lips or face, these may be signs of serious illness.